Welcome back to the Danny and Kait Show, Bakersfield. What's really good? Fresno, how are you doing? Delano, looking good today. Kern River Valley. We have a very special guest with us.
Yeah, we're Let's Talk and Local again, and we have the one and only Dr. Shah with us today from Butology.
Hi, Kait. Hi, Danny. Thanks for having me here today.
Hey, it's good to see you.
Likewise.
Man, have you been working out? You look like you're in really good shape lately.
I really appreciate that. I'm trying to. We're hitting the gym, but, I have my ups and downs.
Well, it kind of transfers into what I think a lot of people are doing right now is trying to live their lives a little more healthier, right?
100%. 100%.
You know, the old saying, what is it? A pinch of prevention is better than a pound of medicine or something like
Pound
that.
of cure.
A pound of cure, is that what the
Yeah.
saying is?
Pound of cure, yeah.
Something similar.
Yep.
So that's kind of what you guys have going on right now is trying to help people with making their lives a little healthier.
100%. Yeah, at Butology, we've always been focused, of course, for many, many years on aesthetics, the outward, but we've, of course, as a community, as a nation, have figured out that it's the inside and the outside. And we want to bring a lot of the wellness to Kern County, to our surrounding community. The same things that we offer in the major metropolitan cities right here at home. And what we now do at our Butology clinics here locally is a lot of wellness medical treatments along with the aesthetics.
So what are you bringing in exactly?
Sure. So, a few of the things, as you know, weight loss is a very, very big thing.
And everyone's on some kind of something right now.
Right. Yeah. Semaglutide, Ozempic. Weight loss has been part of our practice for many years. We're actually making the process a lot more patient individualized, very centric. We start patients off with a full body scan with our Fit 3D body scanner. We get everything from bone and fat mass to muscle mass. And we look at those numbers and together with lab work, we find out exactly what is the perfect treatment, whether it be a semaglutide or something else. And we come back with them with a year-long plan.
So you get that full body image of what exactly needs to be done, because if you don't have all the facts, it's really hard to treat your patients, right?
Exactly. And so and we could track it too. We could we take those Fit 3D scans monthly initially, and then once every quarter or so to make sure they're right on track. Their muscles going up, their lean muscle mass is going up, their body fat's actually going down, and everything else is where it should be.
Yeah, because I know if you lose weight too quickly, you lose a lot of muscle mass. I know you lose it in general with weight loss, but if you're not doing it in the correct amount, your diet isn't there, your medications aren't correct, you're going to lose a lot more muscle mass than fat, and then you become the dreaded skinny fat. Nobody wants that.
100%. So we're looking at protein, we're looking at carbs, we're making sure people are actually eating.
Right.
And sometimes, they're not eating enough. And that's actually the problem. They're not eating the right quality foods enough. So that's one of the things that we're offering. We also are doing hormone optimization with pellets. For
this
patients.
is huge for men too. With a lot of this, I know women do it as well, but I've talked to a lot of guys, especially when you get over 40, when you start losing testosterone levels. And getting that back up so your energy level can get back up.
We call it andropause, and it's in fact, yes, very true. In fact, we see a lot more male clients coming in for this service because they're seeing that. They love the idea. Once we find they do have suboptimal testosterone levels, through lab work and their assessment, they love the idea of not having to give themselves a shot every week. With pellets, we're able to insert these pellets, usually into the backside, and these pellets last for about 3-4 months, which is about the time we want to reassess their labs and make sure it's where they need to be. But they're noticing increased energy. They're feeling a lot better. Plus, there's a lot of other benefits internally that you don't see, cardiovascularly, just overall health-wise, blood sugars and everything. So hormone optimization is another big part of the wellness offering we have now.
Low testosterone affects men all over their bodies. It's not just their energy levels or their sex drive. It affects everything because that's the main hormone that men run off of.
Yep. Mental fog, affects our brain 100%. And bone mass, of course, again, all of it, 100%.
And the pellets have got to be nice because I hear from the shots, you almost have like a withdrawal, right? Because the medication has like a half-life. So you're taking it and then it's slowly backing down. And then you're getting almost like withdrawal symptoms from your testosterone before you have to re-up. And almost like there's a big jump too at the beginning. So you're getting more stable dose of it.
Right. A lot more peaks and troughs with the injection. With the pellets, we don't see that. They slowly release, they slowly dissolve, throughout your blood system. And you get to maintain it a lot more uniformly for months.
I've been trying to increase my testosterone just by working on my car and watching a lot of football.
Yeah.
Watching football.
Some MMA.
Yeah,
Watching each
MMA
other.
stuff. Constantly just like, what's up, bro? Testosterone goes up 2 points every time I say bro.
I don't think it's as effective.
Not as effective.
Yeah.
I mean, I'm sure it helps a little.
Right. So I definitely would recommend looking into that. It's weird. You get to a certain age and it's like a topic that every guy's talking about. Is testosterone levels.
Yeah, because it hits you really fast at a certain.
It's really weird. Yeah, I had my testosterone levels checked out, and my doctor came back and he's like, "These are really low." And I go, "What does that mean?" And he's like, "Well, I mean, we should do something about it." And I go, "Am I transitioning? Is that what's happening? Like, what's going on?" And he said, "No." He said, "Once you get to a certain age, your testosterone just starts to drop off, and it's so important for you as a man to have that testosterone level." So that's awesome.
Yep.
So what else do you guys offer?
So we're doing those two things. We're doing a lot with exosomes. Exosomes are actually stem cell based factors, growth factors that are topically applied. And, we're talking right now about internal wellness, but the skin is one of the biggest organs in our body. And the skin, ages, whether it's aging naturally through just time, or just through sun damage or the elements throughout time that have caused it to age prematurely. What we're finding is putting or using, administering these exosomes, these high level growth factor additives into the skin. We're really kind of turning back the clock. And we do it with either microneedling therapy or another laser we have called the Morpheus 8 laser that delivers those exosomes deep into the skin. And so we're turning back the clock, wellness-wise with one of the biggest organs in our system.
Is it really called Morpheus?
Morpheus
Morpheus
like,
8.
it's called Morpheus 8. What's the Neo? What's the movie I'm thinking about?
I know it's one.
Superhero-y.
I forget the name. It's illegal man. Yeah. But Morpheus was one of the main characters.
Yes. But yeah, Morpheus 8 is the name of the laser. It's a very popular laser now nationally. We have it at both of our offices here in Bakersfield.
Matrix.
Thank you. That was gonna bug me all day.
It's in there somewhere.
It was in my hand. Yeah.
Yes.
So that's awesome. So it works in.
That one helps with like skin tightening, right?
So skin tightening, skin texture,
okay.
helps with stretch marks. It helps with acne scarring. It helps with cellulite. We do body and face with this treatment.
Yeah, a lot of applications, especially with stretch marks and stuff for women who've had babies, like the saggy skin on the stomach, the stretch marks. It's not something we can do a lot about until afterwards. So having an options.
Right. It's a tough thing to go after, but the Morpheus 8 treatment works wonders for it, actually.
I also saw in terms of stretch marks, so you guys are doing like scar tattooing too to try to camouflage it even more.
Yeah, we have a wonderful camouflage artist that's now part of our team at Beautology, and she has this wonderful set of tools that actually analyzes your exact pigment, and she then mixes that pigment, and whether it be post reconstructive surgery, tummy tuck breast augmentation, or if someone's had a scar from birth or an injury that just didn't heal right, she does a wonderful job putting that color back in. So
I saw that pop up and I was like, I didn't even know you could do that. That's an option. I like that.
Yeah.
Have you seen the video?
Yeah, it's pretty amazing.
So cool.
Yeah, she does a great job.
Well, if you guys want to get more information on this, anything here that piques your interest, head to our website, go to rewind981.com, click on the Beautology link, and then that'll send you right over to Beautology.
Or give them a call, 844-BEAUTology.
Wow, that was right there on the top of your head.
Well, I do the commercial, so.
Yeah. It was good seeing you, man. Thanks for coming in.
Likewise. Thanks so much, guys.
Yeah, we love it. All right, we'll take a break and be back.
It's Danny and Kate.